My name is Melissa Lowe, and I'm an assistant professor from the University of Rochester. I'm a geriatric hematologist, and my research focuses on testing supportive care interventions for older adults with acute myeloid leukemia. So, this afternoon, we actually have a case-based session that talks about shared decision making using available treatment tools. And specifically, we're going to use a case of an older adult with acute myeloid leukemia and sharing how we can better facilitate shared decision making in this population by doing geriatric assessment, assessing patient preferences, and then using a communication tool to help facilitate shared decision making in this population. So I'm very excited with the session. And in this population, we feel that it's important that we assess their preferences, especially when we have to make decisions throughout the diagnosis. So in upfront setting, there's a clinical equipoise right now to choose whether we should do intensive therapy versus moderate intensity therapy, especially for those between the age of 60 to 75. So ensuring that we understand patient preferences and values in that context can help us make a decision that align with their care, because there is a differences in practice right now depending on which physicians you see and which institution. So again, knowing what's important to the patients themselves and asking those during clinical visit can really help us reach that decision and make sure there's no decision of regret later on. Yeah, so AML is one of the cancer that can happen pretty quickly, and people usually feel pretty shocked and experience emotional distress. So sometimes it's hard to process the information during that time. So personally, I feel it's very important to bring your loved one, family members, friends to be with you during the first few visits, because that's the visits that we're going to talk about decisions. If you feel like you're up for it, you can access websites like HealthTree AML or Leukemia and Lymphoma Society. They are resources prepared for patients already. You can watch those videos. They are reliable, but if you don't feel like it, you can always wait for that visit, see what the physicians have to say, and then from there, look for resources, because sometimes it's hard to figure out in the beginning what kind of resources or information that you're looking for. And sometimes it's not easy to understand those information in that setting when many people are not feeling well emotionally.